Scientists are at war with COVID-19. Dozens of laboratories are now battlegrounds in the race for a vaccine. Here at Oxford University, volunteers' blood samples are prepared for testing ahead of the first human trials of a vaccine. The blood will be checked for antibodies and any T-cell response to the virus. T-cells can recognize and destroy infected cells. And here in Germany, one small company, part funded by Microsoft billionaire Bill Gates, says it too will soon have a vaccine ready for human trials. It may look like slow work, but things are moving at breakneck speed. It can take decades to develop a vaccine. This lab wants one much sooner.
People are saying, well, that could be 1 year to 18 months, which of course is much shorter than a normal development for vaccines that can be 10, 15, even 20 years.
This is the enemy. Corona means crown in Latin, named because of the spikes on the virus's outer coat. This crown is also its weakness. The vaccines under development contain the genetic sequence of this surface spike, which primes the immune system to attack the virus if it later infects the body.
But what about those most at risk of contracting the virus? Symptoms can range from a runny nose to a sore throat to a fever. But it can escalate quickly among people with respiratory problems or underlying health issues into full-blown pneumonia. One team of British scientists believes our best line of defence lies deep in our lungs.
They've developed this inhaler to help restore levels of a substance called interferon beta in people's lungs, vital for removing viruses from the body. Unhealthy lungs lack interferon beta. Levels also naturally deplete with age, which is why elderly people are more at risk of contracting the virus.
Patients with lung disease, diabetes, pre-existing heart and cardiovascular disease, they get the inhalation once a day for 2 weeks to increase the viral immunity in the lung, to prevent the virus from replicating and eliminating the virus more effectively.
The virus has led to an acceleration in engineering. This rapid COVID-19 test has been developed by the German company Bosch. Blood samples are inserted into the cartridge for analysis. It takes 2.5 hours for a result, and it's 95% accurate. But it could be many months before the equipment's readily available. Meanwhile, a number of firms, including the British vacuum maker Dyson, aeroplane maker Airbus and the Formula One team McLaren, are now racing to develop breathing aids to meet urgent demand. No single company or laboratory can do this alone. It requires international effort and resources. The world's best brains have been mobilised. Our greatest hope lies in science. Neave Barker, Al Jazeera, London.